All right, let's talk about one of the world's most stubborn diseases, tuberculosis. And specifically, we're going to zero in on a really interesting drug called Myambutol. What's so cool about it is that it doesn't just attack with brute force. Nope, its strategy is much more clever. It's all about sabotage.
So you got to understand the core problem with TB. The bacterium itself, Mycobacterium tuberculosis, is basically hiding. It's built itself this incredibly tough, waxy cell wall. Think of it like a fortress, one that's designed to keep most drugs out. So that's the big question, right? How on earth do you get past those defenses?
Well, the answer is you don't send in a lone soldier. You use a team. And that's exactly where Ethambutol fits in. It's a key player in a multi-drug cocktail designed specifically to take down TB. In fact, you almost never see it used all by itself.
Okay, so what's its job on the team? Ethambutol is what we call bacteriostatic. Now that's a fancy word, but what it means is pretty simple. It doesn't actually kill the bacteria. Not directly anyway. Instead, it basically freezes them in place. It stops them from growing, from multiplying, from repairing their own defenses. It just pins them down, which makes them a sitting duck for the other drugs to come in and finish the job.
And that's why its role as a partner drug is so critical. Not only does it make the whole treatment regimen way more effective, but it does something else that's absolutely crucial. It helps prevent the bacteria from developing resistance. And as you might know, drug resistance is one of the biggest challenges we face when fighting TB.
All right, now we get to the really cool part, the how. Let's dig into the actual mechanism of Ethambutol, because this is where the genius of it comes in. Instead of trying to bash down that fortress wall from the outside, it gets inside and sabotages the construction crew.
This is just a perfect way to visualize it. So step 1, you've got the fortress, that waxy cell wall. Step 2, you've got the builders. These are enzymes, specifically one called arabinosyltransferase. Their whole job is to keep adding bricks, a type of sugar, to the wall to keep it strong. Then comes step 3, the sabotage. Ethambutol comes in and literally blocks those builders. It just gets in their way so they can't do their job. And the result, step 4, is exactly what you'd expect. The wall becomes weak, it's compromised, and it starts getting porous.
So what does this sabotage actually achieve? Well, a few really important things. First off, the wall's integrity is shot. It's just weaker. Second, and this is the real game changer, it becomes way more permeable. All those new holes are like open doors for the other, more powerful anti-TB drugs to just pour right in. And third, with its defenses crumbling, the bacterium can't grow or replicate. It's stuck.
Okay, so we've got the how down. Now let's look at the when and where. In what situations is this clever little saboteur actually deployed?
It's a really common one. Ethambutol is considered a first-line agent. That means it's part of the standard initial treatment plan for regular old pulmonary TB. You know, TB in the lungs. But it's not just for that. It's also used for what's called extrapulmonary TB, which is when the infection spreads to other places, like your lymph nodes or bones. Plus, it's also effective against some other related mycobacterial infections, like MAC, which can be a huge problem for people with compromised immune systems, for instance, patients with HIV/AIDS.
But, and this is a really big but, for all its amazing cleverness, this drug comes with a serious risk, one that you absolutely cannot ignore. This is something anyone taking it or prescribing it has to be keenly aware of. The number one major side effect we worry about is something called ocular toxicity. Basically, that means it can be toxic to the eyes. What happens is it can cause inflammation of the optic nerve, you know, that critical cable that sends signals from your eye to your brain. And this risk is directly tied to the dose. The higher the dose, the higher the risk.
Now, there is some good news. The damage, it's usually reversible.
But, and this is the crucial part, that's only if you catch it and stop the drug in time. If a patient ignores the symptoms, that vision loss can become permanent. So with this, timing is absolutely everything.
So what exactly are people looking for? What are the red flags? Well, patients have to be on high alert for a few key things. Any kind of blurred vision, trouble telling red and green apart, that's often one of the first things to show up, or developing blind spots in their field of view. These are the kinds of symptoms where you absolutely do not wait and see. You report it immediately.
And you can see it pretty clearly right here. The risk is all about the dosage. At a standard dose, say around 15 milligrams per kilogram, the risk is pretty low. But once you start pushing that dose higher, over 25 milligrams per kilogram, that risk of eye problems goes way, way up. Okay, so given how serious this potential side effect is, how do we use it safely? Well, it all boils down to following a very strict set of rules. For doctors and patients alike, these really are non-negotiable.
And the rules themselves are actually pretty straightforward, but you have to stick to them. On the do side of things, you have to report any vision changes right away, and you need to be getting regular monthly eye exams. On the don't side, never, ever ignore symptoms, and this next one is a big one. Do not take it with certain antacids, specifically those that have aluminum in them.
Yeah, that antacid rule is a bigger deal than you might think. Why? Because the aluminum in those products can actually prevent your body from absorbing the ethambutol properly. It can basically make the drug useless. The solution is simple, though. You just have to make sure you separate the doses by at least 4 hours.
Now, it's also important to note that for certain groups of people, the risk is even higher than normal. We're talking about patients who have kidney problems, people with diabetes, the elderly, and of course, anyone who already has an eye condition. For these folks, the monitoring has to be extra careful.
So when you step back and look at the whole picture, what you have is a classic medical dilemma, right? It's an incredibly powerful and useful tool, but it comes with a very specific calculated risk. It's a constant balancing act between a massive benefit and a potentially devastating harm.
And I think this quote just sums it up perfectly. That long shadow cast by the risk of irreversible vision damage, it means that educating patients and keeping up with systematic monitoring, well, those aren't just suggestions. They're an absolutely mandatory part of the treatment.
So here's the bottom line. Ethambutol is an indispensable weapon in the fight against TB. Its ability to weaken that fortress wall is just too valuable. But that power can only be used safely with extreme caution, crystal clear communication between the patient and their doctor, and just constant, unwavering vigilance.
And all of this really leaves us with a much bigger question, one that applies to so much of medicine. In this war we wage on disease, a lot of our best weapons are themselves dangerous. The real challenge, maybe, isn't just finding things that work. It's learning how to use them wisely, figuring out how to get all of the benefit while doing our absolute best to avoid the harm.